Good evening, ladies and gentlemen. Today we will be talking about tardive dyskinesia, which is a movement disorder that plagues a lot of schizophrenics and really reduces people's quality of life. I'll go through a series of things you can do to prevent it and to stop it from happening to you if it does happen to you, to treat it effectively. And we'll also talk a little bit about some of the other movement disorders that affect people with schizophrenia. And we'll get started with this PowerPoint presentation with a discussion of the movement disorders and how common they are in schizophrenics. Okay, so here is a list of movement disorders. Tardive dyskinesia is the most common. 32.3% of chronic institutionalized patients had tardive dyskinesia. 13.2% of non-institutionalized patients have it, so about 13% of people in the general schizophrenic population have tardive dyskinesia. Its hallmarks are irregular, involuntary movements. Face, eyes, mouth, sometimes in the trunk, arm, and legs. And this is the focus of this video, is how to treat that effectively. Other movement disorders that affect you are akathisia, which is restlessness. It's hard to sit still. The common treatment for that is beta blockers, which lead to a 50% plus improvement into your symptoms of akathisia. Parkinsonism affects 23.2% of chronic institutionalized patients, or 17.7% of non-institutionalized patients. So in the non-institutionalized group, it is more common to have Parkinsonism than tardive dyskinesia, but both disorders are very troubling to have. Parkinsonism is a tremor of the hands, arms, legs, jaw, or head rolling or twitching. It is generally not recommended to take anticholinergics, so try and avoid those. It also has stiffness of the limbs and trunk, slowness of movement, impaired balance and coordination, sometimes leading to falls. L-DOPA, so you can, if you have Parkinsonism, L-DOPA, supplementing with that, which increases your dopamine and doesn't seem to hurt your schizophrenic symptoms, but you can try that, and increasing dopamine is one of the ways you treat Parkinsonism and is one of the reasons you get Parkinsonism if you have schizophrenia, because your dopamine receptors are blocked due to your antipsychotic. Another movement disorder is acute dystonia, which usually occurs within the first few days of starting an antipsychotic. Muscle movements in head, face, and neck, or abnormal postures. It is helped by an anticholinergic, but this is generally not recommended. You are generally recommended to change your medication if you have acute dystonia. So tardive dyskinesia and Parkinsonism generally start after you have been taking an antipsychotic for some period of time, whereas acute dystonia usually starts right away, and that's one of the ways you can tell which is which. So now we are going to go through a list of things you can do to treat tardive dyskinesia, which again affects 13.2% of the schizophrenic population. So lifestyle things you can do. I stopped drinking coffee. I was getting a little bit of a twitch. I stopped drinking caffeinated coffee. You can still drink decaf for the health benefits of coffee, but you are generally recommended, if you have a movement disorder, to stop coffee. Another thing that really helps is exercise. Exercise lowers your tremors and is another healthy thing you can do. Some supplements you can take. Vitamin E leads to a 50% reduction in tardive dyskinesia. In the one study, it was 1,600 milligrams in divided doses during the day. The starting dose was 400 milligrams and it was slowly increased, but you can consider taking some vitamin E. Vitamin E is quite healthy. You can look it up, it on WebMD or Healthline or some of these other places, and you can consider taking some vitamin E, and it has been shown to really help your symptoms of tardive dyskinesia. Another thing that really helps is manganese. 50% of people were 100% fixed, only 8% with no improvement. 11 milligrams manganese chelate a day is the upper limit generally. The study in question here used 15 to 50 milligrams manganese chelate in divided doses 3 times a day. That was a study from 1970 with first-generation antipsychotics that generally had more movement disorders associated with them. But it's generally thought you shouldn't take more than 11 milligrams a day, but do consider taking manganese because it has a great benefits. The benefits appear very rapidly, within a few days usually. Tardive dyskinesia patients had 50% less manganese in their hair samples prior to supplementation. So in this study, they showed schizophrenic patients with tardive dyskinesia had less manganese in their systems and required more of it. And when they got the needed amount, their symptoms completely went away in half of the patients taking manganese. Adding niacin to those who don't respond or partially respond to manganese often results in improvement. So you can consider adding adjunct niacin and take that along with the manganese. One study had a bad reaction. I wouldn't worry too much about this study because this was a chronically ill patient with multi-organ failure. And so I don't put too much stock into that study. It might be an attempt to scare you away from an effective treatment for tremors. Manganese is a commonly added nutrient to multivitamins, so it's not dangerous as long as you take the under the recommended amount or take the recommended amount. Sexual dysfunction decreases in men and women who take manganese. So a lot of schizophrenics have some kind of sexual dysfunction, and this is helped once again by manganese, though I do not know how much it has helped. Another supplement you can take is Gan San, which is a Japanese herbal mixture. 81% of patients were improved, 18% stayed the same, and 0% got worse. Symptoms almost completely went away in responders. So in that 81% of people who responded, symptoms almost went away completely. It is generally well tolerated. You can consider taking 2.5 grams powder 3 times a day before meals, 7.5 grams total, or 1.5 grams extract 3 times a day. Duration was 12 weeks in this study. Gan San is also a great supplement for your symptoms of schizophrenia, and it causes a 25% improvement to positive symptoms and a 45% improvement to negative and general symptoms of schizophrenia. So that is another thing you can consider taking to not only improve your tardive dyskinesia, but also to improve your symptoms of schizophrenia. And there is a Gan San, I believe, is the Japanese version, and there is another version that is the Chinese medicinal version, and they have two separate names, but both are effective. So consider trying that. You can buy it online, or probably from a Chinese medicinal doctor would have access to this a natural supplement. Another thing you can do is branched chain amino acids, such as leucine, leads to a 40% reduction in your symptoms of tardive dyskinesia. Ginkgo biloba, 50% reduction in your symptoms of tardive dyskinesia, but it does slow some antipsychotics metabolism, increasing your dose. So you have to be careful of that. In this study, they did 240 milligrams a day of extract for 12 weeks. But few people had complete remission of symptoms. So I would maybe go through these in order. Start with the vitamin E, try the manganese, try the Gan San, try the branched chain amino acids, or pick and choose. It's up to you. Another thing you can do is a vascular monoamine transporter 2 pharma treatment that is fairly effective. So it's an average of a 52% reduction in your symptoms of tardive dyskinesia by the Ames test, which is an involuntary movement test. It reduces the amount of dopamine in the presynaptic cleft. One has many side effects, so you have to be wary of side effects. That was tetrabenazine. Much less side effects is the drug deutetrabenazine. Still on the deutetrabenazine, 49% reported much improved or very much improved. But it is slightly less effective than tetrabenazine. 30% reported a greater than 50% improvement to their symptoms of tardive dyskinesia. Another thing you can take is lecithin, phosphatidylcholine, might help TD about 20%. It does help tardive dyskinesia, but the amount is less than the other interventions we've gone through today. Alpha lipoic acid has a 30% improvement in rats at high doses. It has not been tested for TD in humans so far. Some other possibilities, magnesium and calcium might help. DHEA might help, which is a hormone. L-DOPA, if you supplement with L-DOPA as you're reducing your dose of antipsychotics, it increases the amount of dopamine in your brain as the dopamine agonists of the drug that compete for the dopamine receptor are eliminated. You become super sensitive to dopamine. But if you increase the amount of dopamine in your system with L-DOPA, that encourages your body to make less dopamine receptors. So it's something you consider taking if you're decreasing your dose, is taking some L-DOPA, and that should increase the dopamine in your system and tell your body to reduce the number of dopamine receptors and their sensitivity, and that helps with getting rid of tardive dyskinesia, which often becomes worse if you try and reduce your dose of antipsychotics. And another thing you can do is you can try changing your medication to one with less extrapyramidal side effects. So that is another thing you can do. So that is the presentation. There's a number of things you can do. Vitamin E, manganese, Gan San, amino acids, ginkgo biloba, vascular monoamine transporters, and hopefully there is something on this list that will help your Tardive dyskinesia. Don't forget stopping coffee and starting an exercise routine. All of these things should help you to lead your best life possible with schizophrenia. And I know that Tardive dyskinesia, Parkinsonism, and Akathisia are terrible things to have, and they really do lead to a terrible effect on your quality of life. So my heart goes out to you if you're dealing with this. Luckily, I've been fortunate not to have any of these movement disorders as a chronic condition that I've had to continue to deal with, though I have had some twitches now and then that I've fixed by stopping coffee. So hopefully these things can allow you to overcome your Tardive dyskinesia. Let me know if I've missed any things that may also work to fix it. I wish you the best on your road to recovery from schizophrenia. Comments are welcome. Drop a like. You know what to do. And I'll talk to you again next time. Thank you very much. Goodbye.